Hello, welcome to my YouTube channel. Once again, I am Adesua Oni. I am a nurse, I'm a midwife, and I am a graduate nurse. Okay, welcome to my YouTube channel. Yes, if you are a returnee, I'm happy to have you here once again. And if you're brand new in this place, I'm also happy to have you. I'm also begging that you, no, I'm begging that you, yes, subscribe to my YouTube channel, and also put on your notification bell so that anytime I release any other video, you will be notified and you'll be able to view the video. That's a fair one. And also share this video with other people. Yes, other people. In this video, I'll be talking about the part 2 of the last video. I have the part 1 2 weeks ago. So in this part 2, I'll be talking about pregnancy symptoms. In the part 1, I talked about the week 1 to week 20. That's midway pregnancy. Yes. Okay, in this part 2, I'll be talking about week 20 to week 40, which is the period you're likely to have your baby. Yes. It's usually fun. Yes, labor is not fun. Yes, I'll be taking a video on labor very soon, but it's going to be like towards September, October, November. It depends, I want there to be a progression in the release of the video so that you'll be able to follow a particular progression. Yes, that's the word I'm going to use. You'll be able to follow that progression and you'll be able to see that, okay, this is how it's going. So in this video, I'm talking about the 20th week to the 40th week. At the 20th week, you already know, everybody around you already knows that you're pregnant. So that's number one symptom. It becomes very obvious, even if you're very slim and you're not so, you're not on the big side and your body has that grace to cover it all up. It may still show, because at your 20th week, you're already at your 5th month. So usually many people's status of being pregnant becomes obvious in the 5th month or in the 6th month, even if it had not been obvious from day one. At your 6 months, you may not be able to cover up pregnancy again. For some very few people, it's in the 7th month that you know they are pregnant, when they're about to have their babies. Well, these people actually intentionally hide the pregnancy. They intentionally wear big clothes. Maybe they wear hijabs. They wear, some things that are bigger, so that you will not be able to look too closely and say, is this woman, are you pregnant or you're not pregnant? That kind of thing. There's actually no big deal to this thing. There's no big deal. But, there will still be individual differences. There'll be individual differences. So there are some people that want to show off, while some people just want to keep it calm, cool, and collected. They don't want blah around their pregnancy. So in the 20th week to the 24th week, yes, I've been taking it every 4 weeks. I took the 4th to the 0 to the 4th to the 8th week, when you know that you're actually pregnant. And I took the 8 to 12 weeks, 12 to 16 weeks, 16 to 20 weeks in previous video. So in this video, I'll be progressing from 20th week. So from the 20th to the 40th week, that is when the fundus gets to your umbilicus. So what is the fundus? I don't want any big grammar around this video, so I want to explain, I want to break it down very well. That is why I'm here. So the fundus is the top of your uterus, the very top of your uterus. Sorry for that bad habit. The very top of your uterus. This is how the uterus is shaped. It's usually shaped in this manner. It's usually shaped oval. But as pregnancy advances, it balloons out, it balloons out, it balloons out like that. So that's the progression of the size. So now the top, it looks like a balloon. The top of the uterus is called the fundus. It's called the fundus. So the top of your uterus starts to get to your umbilicus. It's when you touch your umbilicus and press it in this way, you can feel your uterus, your baby. You can feel the housing of your baby, the distance where your uterus advanced too, and that is usually around your umbilicus. You know that yes, I'm my 20th week, and if you compare it with your ultrasound result, you see that it is nearly the same calculation. So also in this period, the fetal heart sounds is usually heard. Fetal heart sounds are heard with the fetoscope. You understand? You cannot just sit and be feeling fetal heart sound. It's a sign. It's not really a symptom. It's a sign. So fetal heart sounds are usually heard with the fetoscope. That's if you are seeing my midwife or a doctor, obstetrician, or a nurse, she puts a fetoscope on you. Or in this part of the world, we still use fetoscope. So, but in some places, they use Sonicade, they use other advanced machines to pick the fetal heart rate or the fetal heart sound. So at this period, it is heard very clearly. There is no mixing up of anything. Then the mother herself can feel the movements of the baby. You can now, in the 16th to 20th week, that is when quickening has occurred. But in the 20th to 24th week, the sounds are usually much more obvious. You can feel the movements. You can feel the movements. If you touch, if you palpate and touch and press, you feel the body parts of the baby. You may feel the hand or the leg. You will be able to touch somehow. You may be able to feel your baby. So that is all about the 20th to the 24th week. In the 24th to the 28th week, everything I said about the 20th to 24 weeks happens. The same thing. You'll be able to feel your baby. You'll be able to feel the baby's heart sounds. But this time, the fundus has progressed a little higher. It has progressed a little higher than your umbilicus, just a little bit higher. And then all of those signs can be felt more strongly. Yes. So the fetus can be easily felt. You can feel the fetal parts very well in this period. Now, for the 30th week to the 36th week, this is the time when you begin to feel like, yes, I'm really pregnant. You begin to be like, some people want to make fun of you and just say, oh, look at how big you are. This is the time in which so many people add weight. Like, if you've not added weight all through pregnancy, in this period you definitely get obviously bigger, except in very, very few cases when some people actually lose weight in pregnancy. I've seen instances like that. Some people lost weight in pregnancy. I don't think it is cool, but in pregnancy, actually, you should add all through the period of pregnancy. There's an average of 12 kg that an average woman adds. So yours is either going to be plus or minus. By the time you are adding up to 20 kg, you're already overdoing it. Maybe there's something you're overdoing, your diet, your exercise, your nutrition. There are some things you may need to pay attention to and regularize. Yes, very, very important. So now at this period, to the fundal height comes up, and it comes midway between your umbilicus. It moves up from at the 28th week. It gets in between your umbilicus and your sternum. Your sternum is your breast, your rib, where your ribs begin and form your chest bone, your breastbone. You understand? So it's midway. It was midway. So it now moves away from midway and starts coming towards the costal edge of your ribs. The costal edge of your ribs. You can feel the lower part of your ribs, the lowest part. Then trace it up. If it starts getting to the costal part of your ribs. So and then in this, before I go to the 36th to the 40th week, in this 30th weeks to 36 weeks, urination increases too. Urination increases. You feel like, oh, I want to urinate. But it's not really so obviously bad till the baby's head engages. I'm going to get there. when engagement occurs. I'm going to get there, but actually you feel it. Then when you want to sleep, you discover that you keep turning, you keep trying to find a comfortable position. Some people get tired of sleeping on their side. They'll be like, oh, this pregnancy, let it come, let this baby just come. I want to be free. I want to be able to jump around. I want to be able to move like I used to move. I want to be as active as I used to be. Some people get tired of the whole process at this time. And then some people get tired of sleeping on their side, but you should maintain that as much as possible. When you're tired of sleeping on your left side, you turn to your right side to relieve some of the, some of the headache. Then later you move back to your right hand side. It's not advisable for you to sleep on your back in pregnancy, so that you don't put pressure on the blood vessels that are supplying the baby, yes, the pelvic region. So I said there's increased micturition, that's increased urination at that period. So at the 36th to 40th week, that is when this increased micturition becomes more obvious, especially when the head of the baby engages. So in this period, the head of baby engages. What does that mean? Now, when you do your ultrasound scan before now, your baby may be in breech presentation. That is, the head of baby may be up, or the baby may be transverse, lying as in across your stomach this way, with the legs this way and the head this way. But when labor is getting closer, the baby turns. In most cases, in most cases where the head is presenting, the baby turns and the head faces your pelvis, as though it's getting ready for labor. It wants to come down. So engagement is when, before it engages, the at the 36 weeks, the baby gets to your cervicsternum. That's the edge of your sternum. This is your sternal bone, that's your breastbone. It's a short bone across this way, and it's the one that connects to your ribs, coming this way, to the right and to the left, protecting the internal organs inside you, because there's a reason for those ribs, protecting your lungs and your very, very special organs, so that they don't get easily damaged. So they all connect to the sternum. So the edge, the very base of the sternum, your baby gets up there, and you feel like as if it's getting overwhelming. You get so uncomfortable, like, oh God. You understand? So because the baby is up there, your micturition may not be so consistent. But when you're getting towards delivery day, engagement may occur, and when engagement occurs, the baby goes down, the baby drops down, and it enters into the pelvic brim. Now there's a pelvic inlet, that is the edge of your hips, your hip bone, the edge, the very edge, that's the inlet. So the middle part, where you say, yes, this is actually the space inside your pelvis. This is how we are shaped. That is why we have hips. The hips come this way, then it comes this way. So where that bone is, it's like the packaging like this. So this middle part like this is the pelvic inlet. So the baby tends to drop in, baby's head or the presenting part tends to drop in. If this happens, if engagement happens, then labor is already close by. But for some people, engagement doesn't happen until labor has started. Like for my second baby, the baby's head was still high up. They kept on checking doing my vaginal examination, and they were like, this baby's still high up. Why is this baby still high up, like high? So when there is engagement, baby's head descends. Then there is a relief of the pressure on your thoracic cavity. The woman feels more relief at the chest, but when she feels that relief at the chest, she feels more pressure on her bladder, because the baby has come down again to where we started in the beginning, in the part 1, when the baby just started growing. There's pressure on your bladder. Right now, there's another pressure on your bladder because the baby's head has engaged. So there's increased micturition. You keep going to the toilet to wee continuously, to pee continuously, whatever the word you use is. So that's what happens. at the 36th to the 40th week. And at this period, when the engagement occurs, the woman is able to breathe better. Your breathing kind of feels better, you understand, at this period. So but when your breathing feels better, when lightning occurs, that's what we call lightning. When baby has dropped and then you can breathe better, that's lightning. And when this happens, there is more pressure on your bladder and you tend to urinate more and more and more and more. But don't worry, labor is already around the corner, so there is no need to be to be exasperated or be unhappy or get fed up. It's already here. So have a beautiful day. I hope you enjoyed this part 1 and the part 2. So if you're listening to the part 2 and you have not seen my part 1, please do so. Please watch it, and then very importantly, subscribe to my YouTube channel, and most importantly, share this video with your friends, your pregnant friends, your friends that are seeking to conceive, and their partners, their spouses, their friends, their moms, their mother-in-laws, their sister-in-laws, and so on. Yes, have a beautiful day.